our speakers for our program today. We have like the whole, except for the big cheese, we have the whole Hopkinton Health Department here.
Hello, hello, welcome. My name is Simone Carter. I am the public health nurse here in Hopkinton, and I am joined with my team that I would not be here without. Casey, who actually started the program back in 2019, and Amelia, who came on board, I would say, shortly afterwards in 2020 with the onset of the pandemic. So we thought we would do this a little informally. Feel free to ask questions, and we'll kind of pretend like it's a fireside chat, right? All right, so my name is Simone, and a little bit about me. I graduated from Nichols State University way down south in Louisiana with a baccalaureate in nursing. And my primary hospital experience for the first few years was critical care. I worked as a staff nurse in a critical care unit within the greater New Orleans area for 3 years, and then I spent some time doing contract and travel nursing in critical care. And then from then on, life goes on. You get married, you have babies, and your role changes. I will say that those years in critical care gave me the base, which has led to my further development as a nurse. Over the years, I've worked in employee health. I've helped write and set up safety policies for companies. I have been in the pharmaceutical industry in two main areas. One was the oversight of a clinical trial, which sounds very fancy. In real life, it's a lot of paperwork. It's worse than being an accountant in tax season. And then I worked as a nurse educator for medical devices, mainly with in the area of endocrinology with insulin pumps. More recently, since I took a little time off, I'll be honest, to stay home. I have 4 lovely daughters. I did a little bit of contract work here and there to stay current, but I didn't go back to work full-time until my youngest daughter was finishing up 2nd grade. And I was recruited to work, I don't know, some of you may remember the Natick VNA when it was the visiting nurses in Natick. They had started up a telehealth program that was looking to basically improve outcomes for folks at the very end of the disease process with progressive diseases like CHF, heart disease, lung issues like COPD and whatnot. And through that program, we were able to help them stay at home and just improve their quality of life. The transition to public health was unforeseen, but I was tapped to come on board with the onset of the pandemic. I think initially, probably because of those ICU skills, when things were first starting, they needed nurses with a lot of attention to detail. And that's kind of how I came to public health, and then who knew, I ended up liking it. So here I am 4 or 5 years later, and I think actually the most important thing on my resume is my family, because they definitely come first. So thank you all for being here, and from there I'll just kind of give you a little bit of oversight about public health and what we bring to the town. Public health encompasses a whole host of issues. And in a perfect world, if we are doing our job right, if we had the means, then no one would ever get sick and we wouldn't need to go outside of our own community. We all know that does not necessarily exist. But in the meantime, we are charged with looking at As opposed to a nurse who is one-on-one, we look at our community as our patient, as it were, and we want to see what keeps that patient, our community, whole. So there are many factors that come into play. And a big part of that is social determinants of health. That is a fancy, fancy word for how's your neighborhood, how's your support within that neighborhood, what access do you have to health care, what's your education, what's your economic stability, and finally, what context do you have within the community, what's your social community, and what's your safety net. A big part of public health is traditionally, if you think about the last 100 years, the things that have made the biggest changes in quality of life and longevity of life is actually public health. Things like work safety, clean water, access to maternal health care, vaccinations. Those are all the big things. Like in my mind, I was startled. I was thinking it would be antibiotics, but that's actually not what it was. It was these little incremental changes that public health takes pause and takes a look at. So what I would like to see you come away with today is a little understanding of why we do what we do and how public health nurses can continue to further that vision, town by town, and at some point I'm thinking perhaps region by region, and that we can see that some of these, we would like to see this reach across the governmental side as well and become part of policy so that we can ensure equal and equitable access to services across all towns, not just the towns that perhaps have a better tax base. And I would be remiss if I didn't say that I also believe that we in public health have to change with the times. We are in part constrained by policies and procedures, which are there for a good reason. But as times change and there are innovations that come forward, I think that it is important for us as a profession to stay current and to operate in such a way that we are able to be financially responsible while furthering the public aim. So we're not here to make money, but what I would like us to see is be able to offer goods and services that are needed, that are necessary, and then the return on that allows us to then offer even more goods and services as needed, as determined by what you, the community, need on your level, as well as what comes down from the state and the feds. Currently, and I'll just briefly go over this and then I'll go over what we here in Hopkinton are doing so far. So currently, Massachusetts has no consistent capacity for delivery of public health. It's town by town. There's a lot of research out there, and on this little piece of paper that I've given you just as an educational tool, there is a case to be made for why you need a public health. And I'll just briefly go over that. We are able, through our services, every time we vaccinate someone under the guidelines by the state programs, we are reimbursed for that service, the town is, and then that offsets the cost of having the nurse there to do it. Public health nursing services help decrease hospitalization costs because we are trained. We are your your human capital, as it were. We are trained to assess people within our clinics and offer timely referrals and help connect them to the services that they need. We are also there to assess and monitor the level of disease that is within the community and address that through healthy promotion and programs to help folks figure out how to do it better for themselves. For instance, we have a program here that we run in conjunction with the fire department that is called STEADY, which is all about fall prevention and safety and risk assessments within someone's home if need be, and hopefully we get them the services they need in their home so they can stay home safely without the fall, the slip and fall that leads to the broken hip that then leads to the hospitalization. Again, the thought is with education on prevention and early assessments, we can help get folks connected to their primary care or whatever service that they need sooner rather than later. And nurses also are uniquely able to respond, I think, well, definitely because of the way we've been trained with our assessment skills, we can provide to situations and emergencies that arise in a just-in-time manner because we're always constantly assessing. We're going through the nursing process. So case in point, COVID. When everything fell out with that, who do we turn to? We turn to our nurses. And Casey and Amelia, I think, were the ones who kind of started that effort here in town under, of course, the vision and oversight of our health director, Sean, and our town manager, and we had support all across the board there. So we do work with the school nurses. There are some limitations based on scope and HIPAA concerns. However, we're there as a resource, so if a school nurse has a question, she can always call me. If there's a question with vaccination rates or a need for a vaccination or a need for a quick assessment on something like, say, vision or TB or anything like that, assistance with helping a new child to town get a doctor, they call us and we work with them directly. I'm in the basement. I am easy to find. If you walk in ramp, down the ramp, the handicapped access there in the back, I am the first person you see. I am out and about a lot in the community because we will make house calls to those who need it, but we're right there, and that's where we run the majority of our clinics out of there and out of this senior center. So that will bring me to the next part of my presentation. Woo-hoo! Okay, so if any of you guys are ever bored and can't sleep, you are always welcome to watch our Board of Health meetings. I think that they are archived. And what I try to do for each meeting is I show up with a little, this is a sample of a report to kind of give our board and our community at large a quick picture of what's going on. So part of our job is surveillance. So we do that in conjunction with the state. The state has a system called MAVEN, which stands for something fancy like Massachusetts, something virtual epidemiological network that looks at all of the communicable diseases and it tracks it. I have access to see what's going on in our town. So let's just say that you, I don't know, ate that chicken soup that you left out all night on the stove without really thinking about it, and the next thing you know, your stomach hurts, you go to the doctor, and you end up with a case of something called Campylobacter. There are certain diseases and conditions that are reportable, mandated by state. So that goes That test result automatically is uploaded to the state database, which then pings me as the Hopkinton nurse, and I give you a call first, are you okay? And then 2, we collect data, and some of it seems intrusive, but it's not meant to be intrusive. So they want to know what, we want to verify that you are who you say you are, this is where you live, we want to know what race, what gender, all of these things, because what that does is feed into, ultimately, the CDC, all of our data, and it will show where these diseases are happening, who is it happening to, what type, not you personally, but is there a certain group within our community that we need to provide some more education on? And then also, in the course of our discussion, we're going to go over when the symptoms started, when they didn't, and then what types of food did you eat, because then that would help us identify, wait a minute, maybe it wasn't that you left the chicken soup out all night long. Maybe the chicken that you used from XYZ supermarket was contaminated. And then it's these little local investigations that feed back up to the state, that then feeds to the CDC, that then we all get the alert to say there's been a recall on XYZ product. So we have that. And then in addition to the disease surveillance, we have several other dashboards, and these are publicly available, and they make certain not to disclose anyone's personal information. Again, it's about big data, statistics, and incidents so that we know where to better target our efforts. So there's a database, let me start over again. There is a dashboard that the state has readily available for the respiratory illnesses that are happening right now, so you can kind of get an idea what's COVID looking like in my town, what's flu looking like in my town, the hospitalizations. There's also a database that's talking about opioid incidents, and so there's all that information there, but it does come to us as nurses on a more granular level so that we, within the constraints of your privacy and maintaining HIPAA, reach out and do individual outreach and provide you with information if you need it, right? When you can go back to work, when you're safe, like how to keep your family safe, as well as, again, hopefully get the information to the powers that be if it were something like, say, a bad batch of eggs from a certain poultry farm. So.
Sure. I mean, there's a ton of information that is collected on a state level, about like suicidality, and so that is one of our things that we're trying to work on, in conjunction with
Youth and Family Services,
so that we can create and support programs that will address those issues. There's also, on a town level, they do like a youth survey, and so that determines like youth determinants for mental health, things that may cause them to make like poor lifestyle choices, like drinking, using drugs, and other like risky behaviors. So there is definitely a bunch of data points that are collected broadly from the state that we then use to steer us to programs.
So, to segue, and in keeping with mental health, and part of that kind of brings us full circle to our harm reduction program, which does encompass the use of Narcan as a preventative. We do monthly trainings at the library here on Tuesdays at 5:30. We also do one-on-one. And we also do one-on-one consultations with folks who may be having a crisis in the moment, not as a licensed professional, but in the sense of, I hear you, what you're experiencing is real and valid, let me connect you, let me help connect you to a licensed professional in mental health. So we want people to know that that's out there. Anything else before I move on? Yeah. I'll pass this around. This is an example of our Narcan kit that we train people on how to use Narcan, and there's a harm reduction piece to this. If you guys just want to look and see what's in there, you're welcome to. If you have any questions, you know, feel free to reach out. We also make, there's quite a few materials out in Town Hall. Right when you walk in, there's a table that has, I would say it's my prevention table. COVID test kits that we are receiving free through grants through the state that we want to put out there so that folks don't feel like, especially, you know, maybe you're testing so you can go back to work. You don't want to be paying $20 for a test kit every time from CVS, not to badmouth CVS, but if we have them free through the state, we want to, it's available to anyone in the community. And since it's provided to us through the state, it's free to anybody who walks in. The same thing with the Narcan. It is free to anybody within the state of Massachusetts. And in here, there's Narcan, and there's also fentanyl testing kits, and there's some larger magnets. I don't know if anybody else besides me finds that the letters got super small lately. I don't know, in the last couple of years, the magnets are nice and big, so you can read them and put them on your fridge to know what to do in the case that you find someone unresponsive, some steps you can take. Let's see, in keeping with prevention, right, we have our vaccinations. We are one of the few towns that is recognized by the state as a Vaccines for Children certified, meaning that we give out vaccines that are universally covered to any kid that comes in and needs it. Anybody in the state of Massachusetts, all those childhood vaccines. If I don't have it on me and a child needs it, I can get it from another provider or through the state. We have been, because what we have noticed on the state level is that our vaccination rates for adult vaccinations and routine vaccinations, there's starting to be a gap. And I think that it's a twofold problem. Number one, I think we're all tired from COVID and all of that. And then the other side of it is that due to the fact that our current system of medical care is privately funded, many of those vaccines that are no longer covered under the universally covered Vaccine for Children program are private purchase, and they come at a pretty hefty price tag. So for us to be able to increase that service to the town, we would either have to have really deep pockets and be able to put out a lot up front, or we found a way to partner with a company that is nationally recognized that basically provides the vaccine for us, checks your insurance and bills it, and then we just get a flat administration fee. So it's a win-win because we're not having to put up and allocate that money from the town. We use the product, we give people who need it their vaccines. We get the flat fee back, and then with that, we can grow our offerings. We do weekly wellness and blood pressure clinics at the senior center. Amelia is pretty much the face of that these days. And in those clinics, we will offer a variety of things. One is we love to help folks fill out, especially our older residents, but it's good for anyone, the file of life. Put it on your fridge right next to your Narcan poster. And what we have found, one of the things that if there is an EMS call or if there's an emergency that may slow down the response, one of the things that can help the response all the way across the board, from us in the community to EMS to the hospital, doctors, is having pertinent information at your fingertips. I know that we all are aware that a lot of our records are digitalized, and many systems use a big system called Epic, but that's not necessarily all on hand in the house, and not all of those systems talk to each other. So when the paramedics get there, they need to know what medications you're on right away. And a lot of times, and one of the things that I have found that I think is super helpful for our seniors, is that as times have changed, from when I first became a nurse to now, and managed care, which I think has pluses and minuses, it's become much more itemized. So when you visit your doctor, it's very quick, and so we will have seniors come in with their summary of care and say, like, I don't know what we talked about. Can you explain this to me? And what medicines am I supposed to be taking where? So if we take the time to sit down and review that with them, and then we'll help them write out so that they can carry it with them, their medications. That can go into the file of life as well. It's nice and big handwriting so that I can see it. And then we also have available for them, if they want to carry it in their wallet, a little wallet card with the same thing. That can be helpful. We also offer skin assessments and skin care. I would love for that to expand to wound care. However, that is a skill, and that is something that would take a little bit more planning. But if, say, a diabetic comes in and says, I have a funny place on my toe, can you take a look at that? Your community health nurse can take a really quick look, do an assessment, and say, you know what, yes, I think we need to help you make an appointment with a podiatrist and get them connected right away, so that that little funny spot that may look like just a callus, but actually is turning into a diabetic foot wound or a pressure ulcer, that we intervene there faster, sooner rather than later. Again, improving outcomes for our community. And I would say that definitely Amelia has that special touch, and we don't have the ability to keep a true record other than paper because of HIPAA, but we do keep paper records enough to be able to help folks make that call with their permission, of course, and get them started and follow them. Let's see. A couple other programs I'll touch on, and then you guys are probably don't want to hear me talk anymore, but I think that public health, the future of it is going to really, especially as our population ages, we need to give the power back to the people without sounding too radical here. And when I say that, I mean, you have the power within you. Your health it's your journey. All you need is a little knowledge and a helping hand along the way. So we're here to provide that. I think that one of our best programs going forward is something modeled from the CDC and the state. I mean, it's, again, they kind of give us our marching orders, but it's Healthy People 2030, which is all about healthy lifestyles, healthy brain, and how, as you age, you want to keep your quality of life just where you want it. And you know what? It turns out it's pretty simple. It's about mental health. It's about what you eat. It's about movement. It's about community. It's about something as simple as good sleep and having a good friend and knowing where you can turn. And it's also about the number one thing that makes differences long-term in outcomes as far as decreasing incidence of cancer, disease, is if we can train our younger folks earlier and they have a provider that they can pick up and call and say, for instance, I felt a lump in my breast. It's not necessarily, and I'm not saying that we shouldn't have all these tests. I'm not saying that that's not needed, but it's having the knowledge yourself to know, wait a minute, something's off. Let me reach out and see where to go next. So with that in mind, we are continuing our efforts always to keep our knowledge base up to where it should be and looking forward. And a huge part of that is something called integrative functional medicine. Kathy, I would like you to speak a little bit more to that, if you would.
Yeah, we're just trying to look more into like functional medicine, like what are like the natural things that exist within our life that can determine like how healthy we are. And they are a lot of the things that Simone just listed. So like food, you would think like there would be a lot of knowledge about like what type of food you should eat and how much you should eat of it. And if you Google it, I'm sure you're going to come up with 1,000 different things that say, eat an all-protein diet, don't eat any carbs. And the next one's going to say, eat 50% carbs and 50% fats and don't eat any proteins because animal protein is going to kill you. So like we just really want to look further into a lot of those topics, specifically food, just so that we can share that information with people so that they can have the quality of life that we want them to have. Functional medicine it's like all-encompassing, right? So it looks at nutrition, it looks at making sure that we're moving our bodies and community. There was this great documentary that I watched on Netflix, and it was about different communities that have the highest instance of centennials. Did anyone see it? Yeah.
Yes.
Right?
Yes.
Like so interesting. You would think like, oh, okay, like all these people are gonna have something that's like so in common. It has nothing to do with like where you live, or if you were in America, you can't be that way because everything's poisoned in Europe and things are better there. Like they were completely different communities, but they had really important pieces to their puzzle that allowed them to have the greatest instance of centennials. And so it was a lot about connection and having a community so that if you have a problem, you feel like you can talk to somebody, having that
movement.
Yeah,
a lot
moving
of
your body. And it wasn't necessarily like going to a gym for 30 minutes a day. It was as simple as like
walking
with friends, or gardening, or just doing like your own daily living stuff, and that was enough for exercise.
In keeping with our town's strategic vision, right, which is to continue to build Hopkinton to be a healthy community that's welcoming to a diverse group of people. And that includes our seniors, it includes our children, it includes all ages and ethnicities. And how can we do that? How can we increase? So I'm going to kind of wrap it back up with this. Did anybody see the Bank of Dave yet? Yes. Okay. Yes. I'm just going to go there. In my head, in my perfect little world, our health department is our Bank of Dave, except it's our Bank of Healthy Hopkinton. We are connecting and helping each other stay healthy. Yeah. That's what I want us to be. So and with these, we're all on the same page here, and we all bring something, I think, a little different and unique to the table. And it definitely takes a team.
Yeah.
It definitely takes a village.
I mean, we all came from acute care, and like, I think one of the most frustrating experiences about being a nurse in acute care is that like you see the same people go, come
Again.
back, go, come back, go, come back. So like,
When the bottom has fallen out and you can't do anything
Yeah.
anymore. Like I think our passion is, we can do something so that the bottom doesn't have to fall out.
we want to make sure that like our programs are focused on like, okay, you're not going to be able to like eliminate chronic disease and all those problems, but like, why are they going? Are they going because they're falling? And there's a good chance in Hopkinton that that's it, because we know that I think it's the 35 to 50% of the EMS
All the
calls are
EMS
falls, which is why we did the fall program, because that's clearly a problem for our community. So we are trying to address that so we don't get to the go. We want to stop it before. I think that we're lucky to live in a town like Hopkinton that has like so many resources. So I just want to make sure that we're using all of those resources to provide like the education so that people can live like these wonderful long lives that are full.
And we're here for everybody, like everybody. It doesn't matter, you know, kids, older folks, mom in the middle, like we are the health department. We're just, yeah, Bank of Dave.
One of the main things that, I'll just put in my quick blurb, one of the main things that guys still do, so I originally was the nurse, but I left and Simone was taking on the full-time role. I help here and there, but my main focus right now is working on like our social media and like trying to get our website developed so that people understand all the programs that are available. And I would like to congratulate all the women, because I can see like exactly how many women follow versus men, and men are only at like 15%. The rest of the followers are all women.
Yes.
So great job on your guys' behalf, because we know you're carrying it back home to the guy that couldn't follow anything. But you know, I try to scour social media, the CDC and the state websites to see like what kind of information do they want me to push out, but I also would love to hear from you guys, like what kind of information and topics you would really like to hear about. And I'm glad to like research, post that more.
And I gotta put a little plug in for Nasiba.
Yeah. Oh yeah.
She's on our Board of Health, and she has been like this
Yeah.
one man, just like one lady, I'm sorry, it takes a lady, just really, really progressive and forward thinking, and like making it, she's got to be younger than me because she's better at social media. But it's just, you know, so I think if we all continue to do this, like we can only grow and do better things. So thank you, Nasiba.
Yeah, I think just give us, like, if there's something you're interested in, whether it's like women's club related or not, like let us know. We're happy to like look more into that. Like, is there an actual program that comes from the state level that we can sign up for, get involved in, so that we can provide those services? And
We're
if
getting
there's
you
not,
guys
like,
radon tests.
that-
That's our latest thing. We're getting
Yeah.
free radon tests from the states. So you guys can all play in your basement.
Yeah, I did find that it was National Radon Awareness Week, so
Can
I
I
did.
get rid of the machine in my basement?
Probably not.
Probably not.
Probably
That's
not.
probably there to mitigate it.
Yeah.
Yeah, but I mean, I just want to make sure that we are,
Relevant.
yes, so let us
Yeah,
know.
we're not just the blue, yeah. You have a
And we do
question?
have like cell phones in case anybody has anything, you're welcome to call us. Yeah, like we've had people call us at home and say, oh, I fell. Then, you know, we had to call like a 911 from wherever we were to let them know that, oh, something is happening here, please respond.
Yeah.
So, you know, you're more than welcome to call us.